Thank you very much, Mr. Speaker, and I'm very pleased to rise here and support the bill by my colleague from Etobicoke North. Mr. Speaker, I won't go into the statistics of the number of people in Canada who are living with MS. I won't go into all of the details of the misery of their lives and the tragedy of the quality of their life. But because everyone has spoken about that, this is known, we all know. But what I want to speak about is the fact that the member is talking about ensuring that one of the things about a quality healthcare system is that people who need that healthcare system get the best possible quality of care when they need it in a timely manner. Now, Mr. Speaker, we know that with the advent of CCSVI, that many people who live with MS are desperate. You're living with a debilitating disease that in fact can cause you to become completely dependent on others over a short period of time, depending on how the disease affects you as an individual. So people are desperate to maintain their quality of life, to maintain mobility, to maintain an ability to work and be producing members of society. And so when something comes up that promises that it would help them, and when it is shown that in some countries of the world and in some areas people are being helped, everyone wants to know what to do. It is the responsibility of Health Canada and the Government of Canada to ensure that those patients know what the results of a particular trial, drug, therapy, intervention is, that the people know whether there are side effects, that they know what those side effects are, that they know what the effectiveness of the therapy or the intervention is. And I think it's really very important for the government to move quickly on this. Well, in spring of this year, which is a long time ago, the Liberal Party, clearly with the member from Etobicoke North, stood and asked for clinical trials to begin in this country. The foot-dragging that went on that have resulted only in the last 2 days of proposals going out for clinical trials is appalling, given that you have people for whom the quality of life and their ability to be able to live normal lives, 8 months is a long time in people's lives. 6 months is a long time in people's lives. So to have to wait that length of time is, without putting too fine point on it, insensitive. I could use other words, but I'm saying insensitive. But here we are. Now the trials have been set out and proposals are being asked for, but they are phase 1 and phase 2 proposals. Now, phase 1 proposal, as you have heard, are asking small proposals that look at the safety of the particular intervention or drug. The second phase, obviously, looks at the effectiveness or the efficacy of that intervention or drug or therapy. Now, there's a third phase that the member is asking for, which I think is key, because what this phase does is it does a comparison of the effectiveness of the new drug procedure therapy against the ones that have already been in existence. Is it better? Is it achieving better results? Is it going to be more beneficial to patients if they have access to it or not? That is a very, very key part of clinical trials. That is not being done, and I need to know why. I think it astounds me that it's not being done, because if you're going to adopt something, let us say it proves that the safety is good and that the effectiveness is good, then one needs to be able to give patients the information so that they can make what is known in medicine as informed consent. They know what they're comparing, they know what they're looking at, they know what they're facing, and they are able to make reasoned and informed choices. That is a cornerstone of good quality of care, patient information. Now, so that's the second thing that our member is asking for. But there are other things that the member is asking for. I think she would like to ensure, which is very, very key, that right now people are in fact desperate and they're going out and they are participating outside of the country in areas where CCSVI is available. Now, we know that there have been some side effects. We know that in some cases, some patients have only been helped temporarily. But what we've known is that when those patients come back here, they are treated as if they are pariahs. They are not allowed medical care. They are not allowed assistance that they may need when they have those side effects. It is kind of like a punitive thing that says, how dare you go off and try something because you're desperate? Well, if you do that, we're not going to take care of you when you come back. That is the sort of callous and punitive thing that I think the member is fighting against. She's saying, you know what, if you went across and you were skiing in Switzerland and you broke your leg and you came back to Canada, you're going to get treatment in Canada. You're going to get physiotherapy in Canada. So why are we discriminating against this group of patients who, out of sheer desperation, because of a great deal of foot dragging from this government, have been unable to get the answers they seek and the information they want about clinical trials? And that is one of the most important things that she's asking for. She also wanted to talk about tracking individuals who have received clinical trials in multiple centres across Canada so that we can have an information base that we can see how people are responding, how long, how differently, what are the factors that help people respond sooner or not sooner or better, what are the progression of the treatment in some people. And tracking that is an important part, again, of patient information, of the patient knowing what they're choosing, why they're choosing, and understanding all of the side effects, positive or negative, of different people across the country. Because when you do a clinical trial, you're dealing in phase 1 with a small group, in phase 2 with a bit of a larger group. But when you put the drug or the intervention or the procedure out there, then you're dealing with a very large and a diverse population. You need to track how that population in all of its diversity is responding. That, again, is an important piece of patient information. I mean, it's a sort of a post-market surveillance if you decide that this procedure is worth doing. And so what the minister is asking for is for an urgency in all of this. The member is suggesting that by December the 1st, 2011, that we set up an advisory panel to be composed of experts who have been or actively engaged in imaging or treating individuals with CCSVI, and of an individual, one patient advocate who has been a patient themselves and who has had CCSVI, to be on that panel, so that you have this group of people that are looking at the issue, keeping track of the issue, and advising the minister on the best way to go about changing things. But I think the urgency is what I'm hearing in this. And I think this lack of urgency is what is concerning the member and is what is concerning most of us. I think at the end of the day, if we are going to provide the best health care to Canadians, we're going to have to do our homework. We're going to have to invest in good trials, in trials that will give the kinds of information that people need, and that includes a phase 3 trial as well. We're going to have to look at post-market surveillance or post-introduction of procedure surveillance. We're going to have an open place where people can track and understand side effects and understand what's going on. We're going to have to treat these patients regardless of whether they did or did not have CCSVI as patients in Canada who deserve equality and equity of care and access to care when they need it. So I want to stand here and say there is urgency, and there are some very concrete steps that the member has asked for in this bill. And I hope that we will hear more than lip service to caring about patients, more than lip service to suggesting that we want to do the right thing. There's a lot of lip service going on around here. Let us see some action. And so I want to thank my colleague for bringing in this bill, and I want to give it my wholehearted support.
Hear, hear. Resuming debate, the Honourable Parliamentary Secretary to the Minister of Human Resources.
Thank you, Mr. Speaker. Multiple sclerosis